from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. There was a new warning from the CDC using unusually strong words like alarming and dangerous because of a surge in syphilis infections in newborn babies. So today we're looking at the dangerous complications that can come from these infections, including complications to your heart. We're going to get to that in a moment, but first we have a really terrific update on a patient we profiled in a previous episode of All Things Heart. Nationally acclaimed artist Irma Starr created these nursinomes to say thank you to the cardiac team here at the health system that helped her. And just in time for the holidays, the nursinomes are ready for the public. So backstory here, Irma was diagnosed with a large aneurysm on her aorta, and if that wasn't terrifying enough, the day before her surgery, she got COVID. During that time, she took a picture of one of the care team members who stayed by her side every moment. From this picture, she was inspired to create the nursinomes as a big thank you. And Irma is joining us live today from her art studio, along with cardio-oncologist Dr. Charlie Porter. So great to see you. Irma, you look fantastic. How exciting.
Yeah.
You're on.
Yes, it's fantastic that this nursinome is a way to say thank you to the nurses who worked so hard during the COVID epidemic. They were heroes, true heroes. It was, I was inspired by the nursinome, by the nurses at the hospital who were by my side, and I used a picture that I took of them to create the nursinome.
Irma, it's so beautiful to see you doing so well. You're with Dr. Porter. You're in your studio. You're back to making beautiful things. Dr. Porter, we all know, and the audience knows you're a gifted doctor, you're a cardio-oncologist, but what many of the people watching might not know is that you're also a gifted artist. And you and Irma run in the same circles, and you helped Irma design the nursinome. Tell us about that process.
Yeah, thanks, Alexis. I'd been talking to Irma about this before because we had worked together on a stethonome doctor with a stethoscope, one of her gnomes, and so this nursinome, that term I gave to Irma, and then we started working, and it just turned out that she was swabbed for COVID positive, didn't know it, and Dr. Muehlbach just said she's asymptomatic. This is a big deal. We need to get this aorta fixed. So they went ahead and did the surgery and then had to manage every aspect of her post-op care with COVID isolation, with respirator masks and stuff. And this is a replica that we made, and it's in honor of all nurses. It's, Irma was at KU, but my thinking about this is nurses everywhere. I saw more nurses on TV struggling than I did in the hospital because I'm not in there doing that. But this is really for all nurses everywhere. They're unsung heroes. The doctors, I'm on the video, but the nurses are in there working now. But we worked a long time on getting the details. It even has a little piece of plastic over the respirator mask, and we worked hard to get the mask, the mask pulled back right. We've got our little a giant vaccination syringe here. Don't forget to stay vaccinated. And then
of course, it says
Irma's
got
gets this ceramics beautifully. It says nursinome on the back, and then hero on the front, and that tells the whole story. And we've left a little, when we get these ready, we get enough time. We left a little spot for Irma and I to sign those on the back, so they'll all be personalized. And Irma did a tree ornament for the same thing that goes with her basic idea of. So this is the same thing, and you know, it's got a little insignia on the back, but so there's two ways to enjoy this, and we're just hoping that people who it's a homage to the nurses and other people. So people who are interested in giving a gift for a nurse or someone else who's on the front lines can do this and show appreciation. And it's kind of a fun way to commemorate things. It's whimsical.
It's great.
It's whimsical. It's not serious, but the message behind it is serious. Sincere thanks.
And you are already getting, Irma, tons of orders. We have a QR code that we put up on our screen right now where people can take their phones or go back to this episode, scan it. This code will take you straight to Irma's website. If you haven't checked out Irma's artwork, it's incredible. Our photojournalist Cliff and I got a tour of her studio. It is amazing. What a great gift, just in time for the holidays. The QR code is up. Dr. Porter and Irma Starr, thank you so much for joining us, and thanks for this update. And Irma, you are incredible. Thank you both. Applause for Irma. Yay! All right, thank you both. Now back to today's topic, and today's topic is a really heavy one. The U.S. is seeing a sharp increase in cases of babies born with syphilis. Congenital syphilis is when the infection is passed on to the baby from the mother during pregnancy. Listen to this. The CDC reports more than 3,000 cases last year, which was the highest rate in 30 years. This can be deadly to the baby, and babies who survive are at risk of being blind, deaf, having hearing problems, or developmental delays. Even more frustrating is this is preventable and treatable if it's caught early enough. Please help me welcome today's panel. We have Dr. Sean Sood, who specializes, thank you for being here, in pediatric critical care, infectious disease specialist, Dr. Matt Shoemaker, thank you for being here, and thoracic surgeon, Dr. Todd Crawford in the studio. And joining us virtually, we have Dr. Angela Martin, a maternal and fetal medicine specialist. Thank you for being here, Dr. Martin. And I want to start with Dr. Martin. Is it routine to test pregnant women for syphilis?
Yeah, actually, the CDC and the American College of Obstetrics and Gynecology both recommend universal syphilis screening throughout pregnancy.
So is it a blood test you do?
It is,
And what do you do if the mom tests positive?
Yeah, so the first thing is to confirm the diagnosis. So that usually involves more blood tests, taking a thorough history, physical exam. If the diagnosis is confirmed, the treatment is intramuscular penicillin. And that can be given in the clinic and a health department, so it's a pretty simple treatment.
Dr. Martin, does it need to be caught at a certain time before a certain trimester?
Great question. So the risk of passing syphilis to the baby or the fetus can happen at any trimester. There are even reports of first trimester transmission, but the risk of transmission goes up the further along you are in pregnancy. There's other factors that go into transmission to the fetus. So how much of the bug or the spirochete is in the maternal bloodstream makes a difference, as well as the length of time between treatment and delivery. So we recommend that you get treated as soon as the diagnosis is made.
Dr. Sood, have you recently seen babies born with syphilis?
Yeah, unfortunately, we have seen this uptick here in our area as well.
Wow.
And so the past few months, we have seen a couple patients with congenital syphilis passed on from the mother.
We have some images from the CDC. They're tough to look at. They're images of babies born with syphilis. It's heartbreaking to see this on the most vulnerable person you can have, which is a newborn baby. What are we looking at here, and how do you treat this? These are the outward effects.
Yeah, this is a typical rash that is for congenital syphilis, with that peeling of the skin. You can see punched out lesions. We call it a macular papular rash, so there's smooth areas and there's actual pustules and bumps as well, but that peeling of the hands and feet as well as that overall rash is typical for congenital syphilis.
How traumatic.
Yeah, it's
for
tough.
you and for the baby.
Absolutely.
To see that.
And it's not just the skin, like you highlighted earlier.
Yeah.
It can affect your liver, your hearing, your development. And so syphilis, it's a bacterial infection and can affect every organ system.
We're going to focus on the heart today because this is all things heart, the heart connection. can be brutal. Dr. Sood, you shared some images with us reflecting heart problems from syphilis, and there are a couple of slides we want to put up, and this is where we're going to weave in Dr. Crawford as well. What are we looking at on these two images, Dr. Sood?
Sure. On the slide to the left, that's a normal, these are slides in a microscope, histology slides, and so on the left, that's a normal heart. You can see nucleated cells, and there's no inflammation. It's just normal, healthy heart tissue. On the right, that's the one with a heart muscle that's infected with syphilis. It's a bacterial infection.
Jeez.
And so when you have bacteria in your heart, your immune response is so robust. So those are inflammatory cells that infiltrate the heart, and then it can lead to fibrosis. And Dr. Crawford's the expert here, but with inflammation over time, that can cause aneurysm, stenosis, and regurgitation of the heart. So it's a big bacterial infection to a very vulnerable population that can affect every organ system, especially the heart.
What do you mean by regurgitation of the heart?
Yes, you have valves in your heart, and so instead of blood flowing normally outward, regurgitation means some of that blood flow comes back to the heart instead of out to your other organs.
And Dr. Crawford, what's the biggest cardiac risk that you see when you see patients later on?
Yeah, I think Dr. Sood's point about the aneurysms is important. You know, I am an adult cardiac surgeon, so I don't see as much congenital syphilis, but certainly our attention to syphilitic aortitis has been raised in the recent decade. I know of at least one report coming out of Dallas suggesting that up to 12% of aneurysms resected were related to tertiary syphilis. And I think the issue gets back to maternal care and access to adequate health care. The issue is that in patients with syphilis that are undiagnosed or untreated, they can go into a latent period where they subsequently have these changes going on within their heart or in their aorta that leads to catastrophic consequences. We know that for aortic aneurysms related to syphilis, survival is about 20% at 5 years when untreated. These aortas are not typical aneurysms. And unlike atherosclerosis, which affects the inner lining of the heart, syphilis tends to affect the outer lining of the heart, creating a significant weakening that predisposes to aneurysm formation and ultimately even rupture.
You said tertiary syphilis, and so I just want to back up. So for our audience that doesn't have medical backgrounds, congenital is when a baby has it. What's tertiary?
Yeah, so tertiary is kind of the end results of infection with this bug called Treponema pallidum. But ultimately what happens is the brain is affected, especially the posterior aspect of the brain. And then also the aorta can become an innocent bystander. Wow. And it's the way that the infection itself invades and how it gets through the bloodstream and into different parts of the body.
And we have some myocarditis images we also want to put up on our screen that compares a healthy heart to one with myocarditis. And don't worry, Dr. Shoemaker, we're getting to you in a minute. You're a wealth of information. Dr. Crawford, explain to us what we're looking on at the left and then on the right. So we have a normal heart on the left and myocarditis on the right. Is that the inflammation we're seeing?
Yeah, so the term myocarditis refers to inflammation of the heart muscle. So that can impact both cardiovascular function, but also the functionality of the valves, as Dr. Sood alluded to earlier. And so that inflammatory infiltrate tends to impact the muscle. And in the vascular system, we see these spirochetes invade through the vasa vasorum, which ultimately leads to altered blood flow to different parts of our organ systems.
Wow.
And that's what the end organ injury comes from.
Without a medical background watching this, you hear syphilis, you think STD, but you don't think about all the effects it can have on all the organs in your body. Dr. Shoemaker, I saved you here for last to talk about this from your perspective, because you have an important perspective as an infectious disease specialist. Syphilis isn't a new disease, so why do you think we're seeing this recent surge?
So there are a couple things that happened. One is that during the pandemic, we kind of had a breakdown in some of the testing, prevention and treatment modalities we had. And then you couple this with changes in people's sexual behavior, increasing people living longer with HIV, so HIV co-infection, patients with multiple sexual partners, unsafe sex practices because of how good we've done with our HIV PrEP, the pills that prevent HIV infection. People are letting their guard down with respect to condoms for barrier protection, and illicit drug use. You kind of couple that with some of the things that have already been mentioned with respect to access to health care. You know, there are a lot of things, social determinants of health, where people live is a big factor. You know, do they have transportation? Do they have housing? Do they have food insecurity? All of these things. Because when they looked at the recent uptick in congenital syphilis, 40% of these cases were in mothers that did not have prenatal care. So we're missing a huge portion of the population of pregnant women and just getting them into prenatal care.
And we've talked about that quite a bit on our medical programs. Access is crucial. When it comes to preventing it, it's very preventable. The best way to prevent yourself from getting syphilis is how?
Well, the best way is to not acquire it through safer sex practices.
Right.
But if you think you're at risk, you need to get tested because it is curable. It's one of the few bacteria that has not developed drug resistance over the last 70 years. Penicillin has been the mainstay for the treatment of syphilis since the introduction of penicillin.
If a woman who's pregnant is watching this from home and doesn't know if she has syphilis or not, how would she know? Are the symptoms very obvious?
So no, I mean, in Dr. Crawford mentioned tertiary syphilis, which is 3. There are multiple stages of syphilis. The primary one is when somebody has a genital ulcer. These are painless, so a lot of times in women, they won't even notice it because it may be inside of their vagina. Then you develop something called secondary syphilis where you get a rash all over your body. This will go away in a few weeks, and then you'll...
On its own?
On its own.
Oh, man.
The symptoms will go away.
Yeah.
The bacteria does not. And as Dr. Crawford said, you enter a latent period.
Okay.
And then you have no symptoms, and this can go on for years or decades before you develop tertiary syphilis. So that's why, because you can be asymptomatic, the CDC recommends all pregnant women get tested. In Wyandotte and Jackson County, there's free testing through the health departments. So you can get it through your doctor's office, you can get it through your health department.
When it comes to that treatment, the CDC has cited a shortage of antibiotics used to treat syphilis as a significant problem. So do you think that's playing a factor? And are we seeing that here at the health system?
So I don't think that's playing a factor yet.
Okay.
We have prepared for that. We've kind of triaged how we would use penicillin if we got to an actual shortage. And we've made sure that with our treatment recommendations, pregnant women are at the top of the list. They're going to get penicillin before other populations. There are some alternative antibiotic treatments we can use for syphilis that are okay, but you wouldn't want to use them in pregnancy because the risk of congenital syphilis and the outcomes are so devastating.
We mentioned and touched on it, everybody's nodding, we talk about equity and access to health care, and this surge has created that conversation surrounding prenatal care and access to that care. So to bolster that point, the CDC found close to 40% of the congenital syphilis cases last year were in mothers who didn't receive prenatal care. And then along those lines, more than half of the patients who tested positive didn't get adequate treatment or timely treatment. So Dr. Martin, I want to ask you, as a maternal fetal medicine specialist, how frustrating is that to hear?
Yeah, it's always really hard to hear that there's a good preventable solution to what can be a very devastating disease. I think, Dr. Crawford and Dr. Shoemaker did a really good job of pointing out the access to care issues we have here in the United States. But there are things called maternity care deserts, and that basically means a patient might live in an area where there is no OBGYN provider within a reasonable driving distance. The March of Dimes recently put out a report that found that maternity care deserts affect 2.2 million women in the United States and 150,000 babies. And it's a big issue in Western Kansas. So, you're not going to get screened or treated for syphilis if you don't have access to someone who can do that for you.
Dr. Martin, so interesting you mentioned maternity deserts, because right now in our newsroom here at the health system, we're working on putting together an entire episode on maternity deserts. So I'll be calling you after this program to invite you to join us. Be ready for my call. What needs to change then here to make that happen?
Yeah, it's a really complex
deserts. Yeah,
it's a really complex problem. We need to train more physicians, things like telehealth, finding ways to incentivize physicians to work in rural areas, to keep those hospitals running. I think it does deserve an entire show to itself. It's a very complex problem.
We love when we get community questions. We want to get those questions answered. Here's how you can reach us. You can reach us on YouTube, Facebook, the X platform, and the All Things Heart email. We're available in real time to read your questions. The links are right there on your screen. So let's get right to it because we already have some that were pre-submitted. Janet asks, is it expensive to test for syphilis? Dr. Shoemaker, you're saying no, it's free in most areas or a lot of areas?
In counties where the incidence of syphilis exceeds a certain threshold, then the testing's free through the local county health departments, and both Wyandotte and Jackson County fall into those. So you could go to either the Wyandotte or Jackson County Health Department and be tested for syphilis for free.
Maureen has a question, and she asks, with the exception of babies getting it from their moms, is syphilis always sexually transmitted?
Yes.
Hands down.
Hands down.
Hands down. John wants to know, does insurance cover the cost of the treatment? Do you need to run that through insurance?
So if they have commercial insurance, and we see a lot of patients with syphilis in our clinic, it's covered. Also, a lot of the health departments will provide it with free of cost.
Dr. Sue, Jane has a question. She wants to know how often or how recently have you treated a baby with syphilis?
Just last month.
Oh, man.
Yeah. And so we've seen an uptick here at our health system in this area. And so actually back-to-back months we've had children or babies, newborns with congenital syphilis here at our.
And so when that happens, is the baby's born, does the team that's there in the delivery room whisk the baby off to you? What happens in those moments right after the birth?
So, yes, sometimes they go to the neonatal ICU. Depending, sometimes a baby doesn't have every organ system involved and they're safe to come to the regular floor and just treated with penicillin. So it just depends on the spectrum of disease and how severe that patient's syphilis is to themselves.
And then, Dr. Martin, when you find a patient who has syphilis and let's say is in her third trimester, is there any different protocol when it comes to those final weeks before birth that the mom has to go through, or is there an extra team there in the delivery room?
So treatment right away is the most important priority for us. And then they get extra ultrasound surveillance. There can be findings for the baby before delivery. So we look for those on ultrasound, and sometimes that even means weekly ultrasounds.
Lisa has a question. This would go to Dr. Crawford. Lisa wants to know, is myocarditis treatable, and are there long-term, lifelong complications if you have myocarditis?
Yeah, certainly supportive care for myocarditis is one treatment strategy. Aneurysms are also treatable, which is the good news. The scary part about tertiary syphilis and syphilis-related aneurysms is that they come in all shapes and sizes, and looking at a CT scan or an MRI, I wouldn't necessarily know the aneurysms related to syphilis. That's diagnosed by our pathologist once the aneurysm has been removed.
Got it.
So, we often find out after the fact, not before the initial operation. And I'd probably defer to Dr. Sood as well in terms of treatment of myocarditis in the pediatric population.
Yeah, follow a lot of ultrasounds of the heart to see is our heart function returning back to normal once you eradicate the bacteria or the syphilis. And so it is treatable, but there is long-term surveillance. Just like Dr. Martin's alluding to the pregnant patient in third trimester, we're doing surveillance for these patients weekly, then monthly, until things get better. So it is treatable.
I got to say, one of the things that Dr. Shoemaker, you said is going to stick with me about how if you have syphilis, all the symptoms can go away, which is when symptoms go away, you think, someone watching would just think, well, then I'm better. And then it can be brewing inside you silently and you pass it on to your baby. That's just alarming to hear.
Yeah, and that's why we want to try to identify pregnant people early in the course of their pregnancy and get them tested and treated as appropriate.
Well, this has been an incredible discussion. We are so grateful to all of our doctors for joining us today. And something we love is, in addition to sharing the incredible work that you all do inside these hospital walls, we love giving our audience a sneak peek at what life looks like for you outside the health system.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, doctors always wonder, why am I asking them for personal pictures before a medical show? This is why. Dr. Martin, this is you behind the mask. Explain to us who the cutie patootie is in your lap and the picture on the left.
Yeah, that's my son. One of our favorite things to do is go to the lake and have fun playing in the water.
And who's the other cutie patootie on the right?
That's my husband. He's actually a colorectal surgeon here, and we love to travel, and this was a recent trip. We got to take a hot air balloon ride. So,
oh, that's in the hot air balloon?
Yeah.
Cool. Was that in New Mexico?
California.
California. Dr. Crawford, you sent us some great pictures as well. So let's take a look at Dr. Crawford. All right, let's go through it. 1, 2, 3.
So this is my wife, Tori. We celebrated our 5th anniversary on November 10th.
Aw, congratulations.
And made a bold move in taking our 2 children out of the country for the first time. So the
Wait,
middle
how old are your kids?
So we have a 3.5-year-old Case, who I'm holding in the middle picture, and Tori's holding our 10-month-old Emma Lou. And so we took them to the Bahamas last month to celebrate our anniversary.
How was the flight?
It was interesting.
Did you walk on and say, I walked on with, when my son was a newborn, we flew somewhere, and I walked on and said, I apologize to everyone in advance for whatever happens the next few hours.
We were actually congratulated when we touched down.
Nice.
The babies behaved pretty well. So.
Like, instead of applauding for the pilot making a smooth landing, they applauded for you. Well done. Dr. Sood, you also have a pretty cute person. Well, you have a lot of cute people with you, but let's talk about the cute animals.
Sure.
You're a horse rider?
Yeah.
Is that what we call it? We call it equestrians, I guess, not horse riders.
Yeah, there's Western riding. And,
what are you?
Yeah, Western. And so, stuck indoors all day in the ICU. So whenever I can get out of here, I try to.
Where do you ride?
Oh, just in Lenexa. It's about 10 miles away from where I live.
Do you own a horse?
No.
You just go ride?
I can't. Yeah. And then play a lot of racquetball. That's in the middle. Just got to get that stress out. So those are my racquetball buddies.
Are they all doctors?
No, I try to avoid doctors outside of the hospital. So,
I always imagine doctors and lawyers playing racquetball at the club after work. And then tell us about the puppy.
Yeah, that's when I was in training. I had to try to do different looks. I had a mustache there. All the children were scared, so I had to take off the mustache. But that's Milo.
You were scared of your mustache?
Yeah, and so. I think rocking a mullet a little bit too, but that was Milo, little puppy. I was in residency at that time, and then, training so intensive, so my roommate ended up taking care of Milo, and he's doing fantastic.
How old is Milo?
He's 6 now.
6 years old. And mullets are back, by the way. My 17-year-old told me that.
Oh, yeah.
He said, we can't make fun of mullets anymore because all the kids have mullets. Dr. Shoemaker, let's take a look at your pictures. Okay. You like to fish.
I do.
How big is that fish in real life?
Oh, in real life, it's probably, I mean.
You can lie because you're a fisherman.
3 pounds, yeah.
It's 3 pounds.
It was
this
probably
big.
11 inches.
Okay. And is that catch and release?
Yeah.
Or are you
That's catch and release.
Where do you like to fish?
That's back in the Eastern Ozarks where I'm from.
Oh, nice. Okay, now let's get to the good stuff with your family pictures.
So that's my wife, Erin, and that's our twin nephews, Hayes and Arlo.
Are you the cool uncle?
Oh, yeah.
Yeah. Do they like your bow ties? And
they like my glasses and my beard.
Yeah.
They want to touch the beard and take my glasses off.
Do you babysit a lot?
Sometimes.
Nice. Do they come home all like fueled up on sugar?
Nope. No.
Wild?
No. I would not do that to their dads.
Oh, very smart.
Yeah.
So that you want to keep babysitting.
Absolutely.
Nice. Well, thank you all so much for being with us today, doctors. Thank you, Dr. Martin. You're very generous with your time. We know you're very busy. And thank you for joining the discussion at home. Coming up next week on All Things Heart. A mother's intuition. When doctors pushed her aside, this mom demanded a second opinion, and it saved her daughter's life. The life-saving treatment she found for her baby girl right here at the health system, Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update.
As the days grow shorter, the winter blues can hit harder. I'm Jessica Lovell on the next Morning Medical Update, fighting seasonal affective disorder. How can we protect the emotional warmth in ourselves and the ones we love? Find out Friday at 8.